Morning everyone. Today we are going to talk about a quite common condition called overactive bladder. Some people suffer from a very mild degree of overactive bladder, whereas others suffer from quite severe degree of overactive bladder which affects their quality of life, but they're too embarrassed to know more about it and they're too embarrassed to talk to their doctors or to get treatment for this condition. So what is overactive bladder? Overactive bladder is a condition in which patients have number of urinary symptoms. Patients who suffer from a minor degree of overactive bladder don't necessarily have all these symptoms, which we are going to discuss in a minute. Whereas severe overactive bladder patients will have most of these symptoms. So let's discuss each symptom separately. So the first symptom is increased frequency of passing urine, which basically means how frequently we go to the toilet to pass urine. Most normal people will pass urine every 4 to 5 hours. And at night time, either they will sleep through the night without going to the toilet, or they might get up once to pass urine. If an individual is passing urine more than 8 times in 24 hours, they will be considered to have overactive bladder. If someone is waking up twice at night time, again they will be considered to have overactive bladder. Many patients with severe overactive bladder might be going to the toilet to pass urine between half an hour to 1 hour. So they are passing urine more than 24 times in 24 hours. So they can't even have a normal life to go out to enjoy themselves because they want to go to the toilet every half an hour to an hour. The next important symptom of overactive bladder is urinary urgency, which means when they want to go to the toilet, they really have to rush to the toilet. Otherwise, they will get an accident. The next symptom of overactive bladder is what we call urge incontinence. So when the patient has the urge to go to the toilet to pass urine, they cannot control themselves and they leak urine. And that is again a very common symptom of overactive bladder. Gets worse when the symptoms get worse. So what are the causes of overactive bladder? Overactive bladder can be caused by many medical conditions. In many patients, the cause remains unknown. I have listed just a few common causes of overactive bladder. There are many more causes. Pelvic floor weakness, especially in women, because of pregnancy and childbirth. Nerve damage, for example, in stroke, or spinal injury or spinal surgery, like for herniated disc in the spine. Parkinson's disease, multiple sclerosis. These conditions affect our nerves. Pelvic injury or pelvic surgery, which again makes it difficult to control our bladder. Certain medications like diuretics, which makes us pass urine more frequently, given to many patients to control their blood pressure, etc., can also give rise to symptoms of overactive bladder. Excess intake of alcohol or caffeine can result in overactive bladder. Withdrawal of estrogen hormone, especially in ladies following menopause, can give rise to overactive bladder. But as I said earlier on, many patients of overactive bladder, the cause remains unclear. How to treat overactive bladder? The first thing, especially in patients who have got mild symptoms, is behavioral therapy, which means keeping a diary or a log, changing our diet, which means avoiding too much tea, coffee, alcohol, chocolates, acid-rich drinks like lemonade, citrus fruit, etc. Spicy foods, artificial sweeteners, avoid these things. If we are overweight, to try and lose weight, because too much weight on the tummy presses on the bladder, it makes us go more frequently. Avoid constipation. The same rule applies. If we have hard poo in our rectum, it presses against the bladder and makes us pass urine more frequently. If we are smoking, then we need to stop smoking. The most important part of treatment of overactive bladder is bladder training. Every individual is different. Every individual's habit of passing urine will be different. Some people will be going to pass urine every hour. Some people will be going to pass urine even more frequently. Some bit less frequently. So everyone habit is different, everyone bladder training is going to be different. Keep a diary or keep a log of how frequently you're going to start off with. Say, for example, if you're going every hour and maybe going 4 or 5 times at night time, and this is the baseline from which you're going to start, and this is the baseline from which you're going to improve. Don't try and increase the intervals between passing urine very frequently or by a big jump. Change the time slowly. So increase your duration between intervals by maybe 5 minutes or 10 minutes at a time, and stick to that for a week or two before you increase the interval further. And if you increase the interval further, make sure you don't wait so long that you get a leakage, which means you're waiting too long. If at any stage you think that it's not progressing anymore or it's getting worse, then take a step back and go back to the interval where you were comfortable and give it more time until you can take a step up to a further interval. Important thing is be patient. This will take many weeks or even months to go from an hour to maybe hour and a half or 2 hours, and that is a very slow process. But if you succeed in doing that, then you will not require any medications or any type of operative intervention to control your symptoms of overactive bladder. There are also certain medications available called anticholinergics or beta-3 adrenergic drugs, which can be used to improve symptoms of overactive bladder because they relax the muscles of the bladder. There are more invasive procedures available which may require a small operation to do, like injecting Botox into the bladder muscles to relax the muscles. Nerve stimulation, which are two different types mostly used, sacral nerve stimulation and tibial nerve stimulation around the ankle, in which these little electrical appliances are put under the skin with the wires which stimulate our nerves around the sacrum, and they make us control the bladder a bit easier. Major operations like removing the whole bladder or increasing the size of the bladder by putting patch of intestine in the bladder are extremely uncommon procedures and not very frequently performed for this condition. So I hope you found this video informative. If you did, then please do give us a thumbs up and remember to subscribe. Thank you again for watching, and until next time, I'll see you very soon. Take care.